doing today? Good. My name's Alyssa. I'm going to be your student nurse today. So today we got an order to put a Foley catheter in. And so what that is it's going to go, it's a tube that goes through your urethra into your bladder. And so it's going to help us monitor your urine output and just help you, help us keep track of that more easily, okay? Can I have your name and date of birth? Perfect. I'm going to check the doctor's order, and then I'm going to put you in a position in the supine position, and then raise you up to make it more easy for me to work. Do you have any allergies of betadine, iodine, or latex? No? Okay, sweet. All right. So now that he is raised up, is it okay if I draw back the covers, Mrs. Smith? Okay, perfect. So we're going to get started on perineal care first before we insert the catheter. So after I draw back, I'm just going to place a towel here just to avoid getting your sheets dirty and any contamination on your bedding. All right. Next, I'm just going to take a washcloth and clean him up using different parts of the washcloth. And then I would get a separate washcloth to dab him dry. Okay. Alrighty. So next, I'm going to remove my gloves and then redo hand hygiene. So now I'm going to take my sterile catheter kit out, and I'm going to form this into a trash bag so we can use this for proper disposal. All right. Now I'm going to first, be very careful to remain the field sterile. So I'm going to open away from me and then each side. Careful not to touch the inside. And next I'm going to put on my sterile gloves. All right, and now that the sterile gloves on, I can move those around. So now I'm going to make sure to keep my hands above my waist just to maintain a sterile field and not turn my back on the field. All right, so now I'm going to take the sheet and just extend the sterile field, shiny side down, just to lengthen our field. Now I'm just going to remove this. I'm going to now squirt out the lubricant and then throw that away. Be careful not to touch the back. Then I'm going to squirt the iodine solution and then throw that away as well. Next, I'm going to test the tubing to make sure that the balloon properly inflates before we put it inside of the patient. So I'm going to take throw away. I'm going to put all 10 milliliters inside of the tubing, and so there is no signs of leaking or anything like that. In a real life healthcare setting, we will wait 30 seconds to see and make sure that there's no problems there, but in this, since it's just a mannequin, we're just gonna deflate it. All right, so now that it's deflated, I'm going to remove this plastic covering. And then I'm going to set it inside of the lubricant. Throw that away. I'm going to set it inside the lubricant so that can get lubricated for the patient. So now I'm going to start cleaning with the iodine solution. So now I'm going to ruin my sterile field by touching the patient with my left or non-dominant hand. So I'm going to grab the patient and I'm going to clean them sterilely in a circular motion. All right, perfect. And I'm also going to discard the tweezers or the forceps. Okay, so now, Mr. Smith, we are about to insert the catheter. If you feel any extreme discomfort, let me know and I will be sure to stop the procedure, okay? All right, so first I'm going to take it out of the lubricant. All right, and we are, take some deep breaths for me. We are inserting the catheter. All right, and I'm starting to see urine, so I'm going to keep inserting until we hit this Y right here. Okay, perfect. So it's all the way in. I'm going to hold that with my non-dominant hand. And now I'm going to inflate the balloon. Do you feel any discomfort? No? Okay, good. We're going to inflate the balloon. And then remove that and throw it away. And now I'm just going to tug a little bit until I have resistance. And I feel resistance. So now I am just going to take this up and hang this bag below right here on the side of the bed, and be sure just to be below the bladder so that flows correctly. Okay, and now that I'm down here, so we're going to take a sample for the doctor as he's ordered. I'm going to take it from the bag, but if we had gotten it a couple of days from now, I would take it sterilely from the port up here using an alcohol swab. But now I'm just going to take it from the bag. I'm going to unclamp it. All right, pour, and then reclamp it. Put that back in. Screw the cap on. I'm going to label it with his name, and then I'm going to send it to the lab. All right, Mr. Smith, how's everything feeling? Good? All right, well, now I'm just going to start cleaning up everything, getting it out of your way. All right, perfect. And now I'm just going to wipe that betadine off, just so it doesn't get everywhere and on your sheets. And are you feeling good? All right, perfect. All right, and I see urine flowing normally, so I'm just going to make him a little bit more comfortable. I'm going to put the bed all the way down and the head of the bed up just a little bit to make him more comfortable. All right, and put the head of the bed up. And then I'm going to remove my gloves, and I will come back whenever the doctor orders me to check on you, okay? All right. Hi, how are you doing, Mr. Smith? Good? Well, my name's Alyssa. I'm going to be your nurse today. Today we have been ordered to remove your Foley catheter. So what we are going to be doing first is I'm going to drain your urine from your catheter bag, And then I'm going to take out the catheter, deflate the balloon before, and then take that out, and then I'm just gonna get you cleaned up, okay? All right, I'm just gonna, can I have your name and date of birth? Perfect. All right, and I'm gonna check the order, and I'm just going to raise him back up to a comfortable working height and in the supine position, just like we did before. Perfect. All right. Is it okay if I draw back these covers? Awesome. So I'm going to draw these back. All right. And so the catheter bag is already drained, so we have that taken care of. I'm just going to put this this towel right here, just to help with the mess. And then I'm going to first untake this, and I'm going to deflate the balloon. Just take some deep breaths for me. I'm just going to deflate the balloon and grabbing this to make sure it does not go anywhere. All right, so once the balloon is deflated, all right, take some deep breaths for me, and I'm just going to pull this out, okay? All right, so I'm removing. Perfect. All right, now I'm just going to ball it up in this towel right here and dispose of this properly. All right, and now I'm just going to get you cleaned up. So I'm just going to do some perineal care, being sure to wipe with different parts of the washcloth. And then I would come back and dab you dry with a different washcloth. Okay? So are you comfortable, Mr. Smith? Okay? So I'm just going to dispose of this and get him situated, get him warm, make sure he's comfortable. I'm going to put you to a low and safe position. And then raise your head of the bed up just a little bit. And then I'm going to remove my gloves.